Next from Chicago, Governor Quinn is joined by several lawmakers as the governor signs a bill into law that will expand the Medicaid rolls in Illinois. This expansion of Medicaid, the healthcare program for low-income earners, is part of the implementation of President Obama's healthcare program. Some critics of this expansion say the state cannot afford to spend more on Medicaid, but Governor Quinn notes that the state will get funds from the federal government to pay for much of the rising costs. This runs about 15 minutes.
Thank you. What a special day this is. I made a speech earlier this year, the State of the State, and I said one of our top priorities in the state of Illinois this year was to get this law passed. And I'm very, very grateful to the members of the General Assembly who voted yes for expanding Medicaid. This is essentially implementing the Affordable Care Act. Some call it Obamacare. I call it I Do Care. And this is the way that we, the people of Illinois, are going to get more health insurance coverage for at least 342,000 of our neighbors. I think that's really an important objective that all of us have, decent health care for everybody. And our president made that very clear right after he was sworn in back in 2009. He said it's important that we in this country work together to extend health coverage to people who don't have it. That's an important fundamental right that everyone has. It's not a privilege to have decent health care. It's a fundamental right. And 12 years ago, about this time, I was on the Mississippi River at a bridge called the Centennial Bridge in Rock Island, right above the river, big river, and I was with my doctor, Quentin Young. And we walked across Illinois from the Mississippi River all the way to Lake Michigan in Chicago. We walked right by this very building on behalf of decent health care for everyone. And I've always believed that. You know, it's important not only to have a belief and concern and a vision, but you have to actually accomplish it. You have to have a record of getting it done. And I want to commend all the people who worked on this historic mission, not only members of the General Assembly, but all the organizations, all the individuals who banded together, who understand that we in America, we can do better when it comes to health care coverage for people who need it. And today in Illinois, the home state of President Obama, who will be here in our state this week. On Wednesday, he's going to Galesburg. And I was very, very concerned that we get this bill signed into law today, before the president gets here, so we can tell him we got the job done. I think it's also important to realize that the signing of this bill creates jobs in Illinois. I had a lady come when I was walking in. She said, we need more jobs in Illinois. I totally agree with her. I work on that every single day. All of us have to work on that. And we know that health care is a very, very important sector of our economy. And we're going to be getting $12 billion in the next few years from the federal government to our state to implement this important health care reform. And that is going to put people to work. We want folks not only to get health insurance coverage, but we also want the other principles of the Affordable Care Act. You can't deny people because of pre-existing conditions. You got to make sure that people get a fair shake when it comes to their health insurance. And so I want to make sure that the folks who made this day possible in the legislature, when I spoke before the legislature in the State of the State address, I said that we have to team up together. Members of the legislature I talked to and members of my staff talked to about how important this is to our economy in Illinois, to our health care safety net. We want to make sure that no one falls through. We want to have a wellness society in Illinois. We don't just want to treat people when they're sick. The passage of this law that I'm going to sign today also makes sure that we have preventive medicine. And we're going to work with great hospitals like we have here in this very institution, as well as around here. There's 3 other major hospitals, Stroger Public Hospital, as well as Rush, and also Jesse Brown Veterans Hospital. But we have so many other hospitals in Illinois. And I want to thank the Illinois Hospital Association for their fervent support in getting this done. We're going to hear from them today. And we have many, many more folks who have made this day possible. But I really want to bring forward now someone who sponsored this bill, who's always been a strong voice for decent health care. That's Senator Heather Steans. Come on forward.
All right. What an absolute privilege to be able to sponsor this bill, and I really want to thank the governor for his absolute stalwart leadership on this. He has been such a strong supporter for health care for poor folks throughout his entire career, and this is such a great culmination of that. Couple points. As he mentioned, there are 342,000 more Illinoisans who are going to get health care coverage because of this bill. Now, 60% of these folks have jobs. It's all single adults, these newly eligibles. 60% of them have jobs, but at low-income jobs that don't provide affordable health care. And the other important key is to know is that every part of the state, people get views about who this is at getting coverage. We had done the analysis, and it's every single part of the state where we have people who are going to be newly eligible here. It's critical for downstaters, for our suburbanites, for the city of Chicago. It's everywhere. And there's three sort of really key benefits to getting this bill enacted here. First, and most importantly, it's better health care for folks. We're going to be keeping people healthier. As the NIH says, 14%, estimated 14% of health care right now is provided in emergency rooms. And that's largely this population of single adults who are showing up in emergency rooms because they don't have access to health care. These folks are now going to be getting access to preventative, coordinated care programs, thanks to the leadership of Julie Hamas and her department, which we're going to hear about, providing much more coordinated care for these newly eligible folks to get them things like mammograms and colonoscopies, get them their blood health, their blood control medications, or if they have diabetes, get them asthma control. All these kinds of things to keep them out of emergency rooms and keep them healthier. That leads to the second big cost, and that's, second big benefit here, and that's really economics. We are going to get $4 billion over the next 3 years, $12 billion from the feds over the next 20 years, through 2020, it's estimated. $12 billion into the state, no cost to the state for the first 3 years of implementing this program. After the first 3 years, the federal government, it tapers down to about 90% of coverage that they provide for this group. It replaces what the state's paying for right now, what local governments are paying for right now, and really all the uncompensated care that hospitals are having to do. So this is going to help every single hospital throughout the state of Illinois. And it also helps small employers who will no longer have to pay penalties because if folks that could be on Medicaid can now have access to that. They'd be subject to penalties if this was not the case. Another reason why the Illinois Chamber of Commerce was such a strong supporter of this bill and worked so hard to help get it passed. And then the third key benefit really is that we're going to create an enormous number of jobs. I've seen some reports that estimate up to 19,800 jobs throughout the state are going to come because of us implementing this bill. So that's really the contours of it, why it's so critical. One thing that might get overlooked that this bill is also doing is really providing new models of care for a very underserved population in Illinois, and that's folks with mental illnesses. We're creating a new continuum through specialized mental health rehab facilities where right now people with mental illnesses in Illinois end up in hospitals, emergency rooms, they end up on the street, they end up in the jails. We're now going to be stretching and improving the quality of care that we're providing to these folks with mental illnesses, which I think is another very valuable part of this bill. Look forward to working on the implementation. It's now a lot of work. There's a lot of hands on deck to get this bill passed. I want to thank everybody here because you all had a role in that, and thanks particularly again to the Governor Quinn for his leadership.
All right. I told Heather that was an encyclopedic description of this bill in less than 2 or 3 minutes. And someone who, you have to pass a bill in 2 houses. And I worked with members of the House and the Senate. But the leader of our health care agenda, somebody who really understands how important it is that everybody's in and nobody's left out when it comes to decent health care, is our next speaker, and that's Representative Sara Fagen. Come on, Sara.
Heather Steans made those remarks without taking one breath. Great respiratory system you got there, Senator. So now that there's nothing left to say, I think one of the things, I've been in the legislature for a long time, and prior to that I worked for the Senate President when he was a mere House and then mere Senate member. And the people who used to live and walk into our office and that lived in our community we had the largest single head of household community. We had the largest onesie community, if you will. Many of them were students, a lot of entrepreneurs and small business owners. And our district was disproportionately affected by people who were those very childless adults who did not have access to health care. So from the perspective of a legislator, trying to meet a need, trying to find a medical home for our constituents, this legislation today is the game changer. I think we should all take a moment and thank the big guy in Washington for that. It was always a pleasure to work with President Obama when he was in the legislature, and for him to, today with a single stroke of the pen, Governor Quinn will bring 342,000 Illinoisans who have been scrambling along with HFS, DHS, the Department on Aging, for this community to try and figure out how to get their needs met. And we also pay enormously for this in other parts of our budget and in other parts of society, as Senator Steans met. I remember hearing a story about a woman who felt a lump in her breast, and she had no place to go, and someone in her community told her to walk into a small business and shoplift, and that if she wanted health care, the best place for her to get it was county jail. And I think that today we change all that. Today we sign a document that reflects the principles and the direction that the state of Illinois is going in. And I want to also thank all of the advocates, the very, very diverse, non-traditional allies that work together for this common good. It was an honor to shepherd this through the House. It was challenging. One would wonder why we wouldn't want $12 billion of health care that is 100% match. For the first time, we are getting federal match for people living with mental illness in the state of Illinois. So we are not just walking the walk or talking the talk. We are really putting our money where our mouth is, and we are going to finally find medical homes. And also, the leadership of HFS and the fabulous Julie Hamos and her staff cannot be underscored.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.